Hello, everybody. So this is the first video lecture on the chapter 3, which is about the birth, the birthing process, and the state of the newborn. Something that I guess I had not considered before I was preparing for this chapter was the information presented right here in this talk that at 266 days, and this would be the 40 weeks, right? This would be exactly at the 40 weeks. A baby has to regulate their own body temperature, breathe on their own, and take in nutrition through feeding, which I don't know why I had not considered this, but this is very different from the baby's experiences prior to delivery. So I was always sensitive to or aware of that the birth process itself was very traumatic for both mother and baby. But when it's framed like this, it really made me think about the process a little bit differently and how really profound and incredible the whole process of childbirth is. I don't know if you've ever had a chance to be with somebody when they are delivering, but I would certainly recommend it it's a really an incredible thing. Even if you've done it yourself, yeah, that's pretty incredible. But to watch somebody else do it is definitely an eye opener. But not only is this preparing for birth, right? So you have the baby is preparing for birth, the baby is positioning itself, but it's also, especially for first time parents, this is also a very big event and requires a lot of adjustments for parents too. That their role, their relationship, and I think this is something that is, well, I don't know. I was going to say, I think this is something that we don't discuss enough, but the very nature of the relationship that parents will have with each other will change profoundly. One of the things that my husband says is to young families, he says, yeah, you don't think about the fact that you won't be able to go to the bathroom anymore. He doesn't use that word, but you won't be able to go to the bathroom when you want. Like the simplest things as using the toilet are now controlled by this little bitty thing that is, 7 pounds, 10 pounds. So your book spends quite a bit of time talking about all of the different approaches. This is the term they use, approach to childbirth. And there's several pages that lists how they are all different. I may turn this into an exercise for you to sort of reflect on what's the difference between, say, a locust birth and a Bradley birth. But suffice it to say, there are lots of different ways for women and couples to approach childbirth. I've put some of them here. So you can choose between having a medicated birth, well, your birth plan, I should say. One of the things that I think is also important, if you're speaking to somebody if you're talking to someone who anticipates experiencing childbirth, is we have a birth plan. We in our mind plan out how we want that to be, but how we want that to be and how it ends up being often are nothing. So when I was a young pregnant woman for the first time, I wanted a natural childbirth. I wanted a birth like women had done for centuries, unmedicated, to have that baby when that baby wanted to be born, and that was not what my experience would be at all. Rather, I had a highly medicalized cesarean section, highly scheduled pregnancy. So the point is, we got lots of different ways to do it, and we can, in our mind, imagine how we want it done. That doesn't necessarily mean it's going to work out that way, but it still is an incredible thing, even if your plan isn't what you had envisioned. So one of the considerations is medicated versus unmedicated. Do you want pain blockers? Or do you want to experience the full effect of this phenomena of a baby moving through the birth canal? Where do you want this? Some women want to be able to give birth at home. Others are much more comfortable in a hospital. I ask my students that in the human growth and development class. I may ask you that too. What would your preference be? And there's a variety of reasons to have it in either place. A natural, that's usually a term associated with a birth that happens without medication. But other things that come under the umbrella of natural are episiotomies, um, uh, vacuum where you suck the baby. There's lots of things to consider that are not just pain blockers or not. A water birth is a consideration. Well, to deliver in a tub of warm water. Lamaze is often used as sort of a generic term for women who have learned how to breathe and to focus through the birthing process. I know I learned a little bit of it when I was pregnant for the first or the second time. I don't remember. I've had two pregnancies. My first pregnancy was a cesarean section because my son's intestines were on the outside of his body. It was cesarean at 36 weeks. And my second pregnancy was induced at about 41 weeks, which we'll talk about also somewhere in here. Neither of them were as I would have imagined. I like to say that had I been pregnant on the savannah, I probably would have died and not had any more children. But that's for another conversation. So locations are to consider: home, hospital, or a birthing center. Birthing centers are places specifically, they're like the labor and delivery specialists. They may have access to some other considerations, such as who is going to be available. Are these going to be specialized physicians? Are you going to have a midwife who is often a nurse practitioner? Highly skilled in delivering babies. That's their specialty. Are you going to have a doula? And a doula is sort of like a support person. Both of these people are paid support people. So there's lots of different ways. I like to believe that women have been delivering babies since the dawn of time. Their bodies are built to deliver babies, and that women are the best people to help other women. But that's a belief that I have. That's just a philosophy. There's nothing wrong with relying heavily on medicine specialists and hospitals and these kinds of things. These next two slides are really about the stages of childbirth. The way it's described in your textbook, sort of use the notion that we have 4 different stages. Most textbooks will talk about 3 stages. There is a quiz question about stage, so we will talk about like the onset. The onset is not considered a stage. I hope I'm not being overly confusing, but prior to moving into what we would call regular labor, we go through a period of what you might have sort of on again, off again, or the sensation of contractions. We call these Braxton Hicks, or false contractions. But typically, the onset of childbirth in a typical pregnancy would happen about within a week of her due date, and due dates are attached to ovulation, right? So within about a week, there is a phenomenon called the bloody show, and this is where the mucus cork that covers the cervix. So the cervix is the entrance into the uterus, and that fills up with a mucus cork to keep everything inside. But about 1 or 2 days before we go into the regular onset of uterine contractions, that cork will leave. And with it often comes a spotting of blood. So that's often called the bloody show. Then you have the oxytocin. Oxytocin is a really important hormone that we'll talk about throughout other parts of the semester. This is the cuddle hormone, but interestingly, oxytocin levels go up at 3 different times in a woman's life. One is childbirth, labor and delivery. One is nursing and breastfeeding. When a child latches onto her breast, she has a flood of oxytocin. And the third time is actually during orgasm. So this is called you probably heard me say this in maybe the psychology class. This is what we call the trust hormone, because we have the sensation of trust and affection. But interesting that this is also the hormone that is responsible for the onset of contractions, which, as we know, can be very painful. Okay, so I'm at my 10 minutes. I'm going to stop here, and in the next one, I'll talk more specifically about the 3 stages of childbirth.